And welcome back. The Thinkubator and Bronx Community Foundation conducted a survey of New York City residents and their response to the COVID-19 vaccine. The survey shows the respondents' knowledge of the vaccine, where they received their information from, and whether they'd actually like to take the vaccine or not, and the reasons for their decisions regarding the vaccine. Here now to share a little bit more about this is the Thinkubator's president and CEO, Dr. Edward Summers. And then we also have the lead facilitator and manager of Youth Voice, Julian Joyner. And welcome both to the show.
Thank you. It's our pleasure.
Yeah, thank you for having us.
Let's go right at it and talk a little bit about this survey. Dr. Summers, give us a little bit about the background as to why you felt this survey was particularly important.
Sure, thank you. So the Thinkubator and the think tank at the Thinkubator teamed up with the Bronx Community Foundation to think about COVID-19 and its impact on the Bronx. And we wanted to look at, in particular, hesitancy and whether folks, as the COVID-19 vaccine has been announced in December and in January, want to look at whether Bronx residents will take the vaccine. And if they would, what were some of the factors influencing their decisions to take the vaccine and or not take it. So we were really thinking about how, if, health has been a major issue in the Bronx, as we know. We know that COVID-19 has severely impacted the Bronx. The Bronx has been ranking fifth in the nation in terms of the number of deaths and the number of cases as well. And so we wanted to really think about and see and evaluate what were going to happen in the Bronx, what were residents thinking. And so what this study revealed to us is the stark difference between what residents in Manhattan and other boroughs were thinking compared to the Bronx. And particularly started to look at whether people were just going to take the vaccine. And we noticed that nearly 60% of residents from Manhattan and other parts of New York City were going to take the vaccine versus about 46% of Bronx residents decided that or stated in the survey that they were going to take the vaccine, which for us is it's significant. That's nearly about 13, 14 points spread between those in the rest of New York City versus those in the Bronx. And so for us, that's a big indicator that there's work that needs to be done in the Bronx to make sure that we have a healthy Bronx, a Bronx that doesn't continue to rank fifth in the nation in terms of the number of deaths and the number of COVID-19 cases. So that was really the impetus behind this, is really just understanding people's perspective on the vaccine and understanding whether they were going to take it or not.
Yeah. Julian, with that number right out there, being number 5 in the nation in actual deaths, that's a huge number. And so the vaccine would definitely seem like something that people would want to take. But I know that your survey has shown some pretty interesting statistics.
That's exactly right. And it makes sense to us that folks would have misgivings about taking the vaccine, especially with what we've seen historically in Black and brown communities. The Tuskegee experiments come to mind. A lot of folks had voiced that the quick turnaround time in the development of the vaccine and the subsequent release were some things that sort of made them uncomfortable because typically these sorts of things take a lot longer. But it is alarming because like Eddie highlighted, and like you just stated, fifth in the nation is huge. In one of the richest cities, on this earth, certainly one of the richest in this country. It's alarming that we have so many folks who are so greatly impacted by this and that are not able to either have, sterling information about the vaccine or access to it. And a lot of what we were seeing initially is that when these vaccine sites were cropping up, is that a lot of folks from outside of the community were coming in to take advantage of it. And so we wanted to better understand, in our own communities, because we don't just work here, we live here as well, what was the hang up, and was there anything that we could do to sort of understand better and assuage some of these concerns?
Julian, give me a little bit more about the hesitancy. How much of did you find a hesitancy? We know that there's that talk about the Tuskegee experiment. We know about the disparities between within healthcare for Black and brown communities. So right here in the borough of the Bronx, from what you found, how much of a hesitancy did you uncover?
Sure. So I'd like to highlight that we did a separate survey that just focused on the residents of the Bronx. And in that, we had about over 50% of folks who said that they would not take the survey, that they were feeling some sort of hesitancy around it. Many of those folks said that they were getting information not from medical professionals, but from folks in their own family. And I believe that when you have, that sort of information, and you're not necessarily getting this information from the CDC, or you're not getting this information, from your doctor, but you're getting this very anecdotal information. So for example, most of them were concerned about the side effects of the vaccine and what it might do to their body. Most of them had, even though they didn't say that they would want to take the vaccine, they had a pretty positive outlook about it in general. And then we were sure to make sure that there was an even split between the youth and older folks in surveying these responses. Surprisingly, though, youth were more reluctant to taking the survey than the older folks.
Wow. Dr. Summers, with this survey, obviously a lot of information, a lot of data is shared. What is the plan with this information going forward?
Sure. So in our policy brief that we released, what we have is outlined 3 recommendations. Given what we know about the hesitancy of Bronx residents, in our policy brief, we talk about a strategic communication plan in terms of really thinking about how we communicate the pros and cons of the vaccine. Now, we're not taking a positive or negative position, but what we really want folks to do is to really think about the pros and cons of what it means to take the vaccine or not take it for our respective community. And what we state in this is that we need a boots to the ground strategy, similar to the way in which politicians campaign when it's election season to garner people's votes. We feel like we need an information campaign similar to that, where elected officials, church leaders, celebrities from the Bronx are going on the ground to really talk about the pros and cons of the vaccine. We, again, can't mention enough, being 5th in the nation, that's huge in terms of the number of deaths and the number of COVID cases that we have in the borough. So that's one part of the strategy. The second part of the strategy is to really look at these structural issues that Julian mentioned. The fact that in the beginning, when the vaccine was first being distributed, that many people from outside our community were coming into our community to take the vaccine. So we need to really think about some of these structural issues about where the accessibility of the vaccine, where we're actually giving the vaccine out at. Increasingly, we're seeing a little bit more and more of sites like Yankee Stadium pop up, where it's now 24 hours. And so, but we need many more sites in the localized communities, in zip codes, in communities such as Mott Haven, in Highbury, and other communities, to make sure that there's true accessibility. We need that Rite Aid, until not just Rite Aid, but the local pharmacy. I know in the Mott Haven section, Kramer's Pharmacy has been around for 60 plus years, and that's a staple in that community. People trust Kramer's, they don't trust Rite Aid necessarily in the Mott Haven. So we need to think about these community assets where we could be able to distribute their vaccine. And then the third is making sure that there are resources going to organizations who are, quite frankly, out there on the front lines talking about the vaccine and trying to disseminate information. We need to make sure that our city and our state government, and even the federal government, is dedicating resources to these entities to make sure that we're able to make sure that many people are getting as much information as possible about the vaccine to make informed decisions about the way to take the vaccine. So those are our recommendations. We've released this to the city, we've released this to the state. We've already seen some reaction to our recommendations in the affirmative. I know also that our partners, the Bronx Community Foundation, they are thinking about their action plan and what they're going to do to support these efforts. I know that they were hiring a COVID-19 project manager to think about their reaction to COVID-19. So these are some of the things that we want to see for our borough, because healthcare is critically important of our borough, and we know it's tied to not only health but everything else in our borough. The successful reopening in our borough, the economic vitality of our borough. This is all connected to how we respond to COVID-19. So it's critically important that we have a community engaged response to dealing with this issue.
Julian, I got to wrap up, but I got to ask you this question before we shut down. When the vaccine becomes available to young people, any indicator as to whether or not young people will actually be willing to take the vaccine?
I believe they will. I believe that as it starts to roll out and more access becomes available to it, that they receive more information, maybe from news sources, maybe from more people that they trust, maybe more than this anecdotal information that they're receiving from their family and friends. I think that they will be more inclined to take it.
All right, Julian, we got to wrap it up there. Julian, Dr. Summers, thanks so much for being with us here on Open.
Thank you so much for having us.
Thank you.
All right. Well, listen, now, if you want more information, do us a favor. Visit their website at thethinkubator.org. And then you can also follow them on social media at The Thinkubator. We encourage you, stay with us. Don't go anywhere. We've got more Open coming up right after this.